last homework assignments. And so this is due a week from today, and it has to do with osmoregulation. So what you want to do is read this, maybe do a little additional research. You might have to Google some things, and then answer the questions. Is this homework?
That makes me 7.
This is due the 7th of March. Yeah, it was 21st.
At 1.
Did you get one? Okay, everybody got a copy of the homework? Yes. Okay. So does anybody remember what are the units, what that blood pressure is measured in? But what are the actual units, like centimeters, millimeters? It's pressure, so what is it measured as? Nope. It's a weird one. No. Millimeters of mercury. Oops, mercury. That's a Hg. So this is millimeters of mercury.
Why mercury?
That is just a standard, and this is actually how we measure atmospheric pressure using a barometer. So standard atmospheric pressure could be 760 millimeters of mercury at sea level. And so this is the pressure that is exerted by us on the atmosphere, and it's the pressure exerted on a column of a certain amount of mercury, and that's why it's measured in millimeters of mercury. So when we look at the value, remember we talked about how you could have 120 over 80 millimeters of mercury. So is this in the arteries or in the veins?
In the arteries.
Arteries. And so traditionally it is taken in the brachial artery, which is the artery in your arm. So we're going to do this in lab tomorrow, where you're going to use a blood pressure machine that is going to inflate the cuff on your arm. So what happens when you do that is you inflate the cuff until you completely cut off blood flow to the arm. So you collapse the brachial artery. And the reason why they use stethoscopes is you can actually hear the flow of blood through the artery. So you put the stethoscope right here, right? And so when the blood first starts to flow, as the pressure is released from the cuff, it will make a sound and it will go tap, 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 tap. And that's when the blood first starts to flow, and that is what is referred to as systolic pressure. So this is my systolic pressure. But it is not flowing in a fluid way. It is flowing in a very chaotic way, and so it makes a noise. So on the blood pressure machine, you'll see it going, right? And then all of a sudden, it will just level out and it will stop ticking, and that is when the diastolic pressure happens. So the diastolic pressure is actually the lowest pressure exerted on that artery that allows blood to flow through in a fluid way, in a laminar way. So it flows through without making that chaotic noise. So that's what people are listening for when they do manual blood pressure cuffs. And this is what the blood pressure cuff is actually measuring when you use the automatic one. Okay. So when we look at blood pressure, this is something that we need to maintain using a homeostatic mechanism, right? So we can talk about homeostasis. So we do not want our blood pressure to become really high. If it is high, it is said to be what? If you have high blood pressure, you have what? It has a term associated with it. You have hypertension. So hyper means high. So hypertension is high blood pressure. So this can cause a variety of problems, including it could lead to ruptured blood vessels, but it can also damage your kidneys because the kidneys are filtering the blood. And so if the blood comes in at too high a pressure, it can actually kind of blow out the filtration membrane and you can get blood in your urine. So hypertension over a long period of time can also damage the heart, right? So it's something that we need to try to maintain a lower blood pressure. However, if blood pressure becomes too low, then you get what is called hypotension. So this is low blood pressure. And if the blood pressure is not high enough, it cannot pump blood to the brain. And so then you will pass out. So people will feel weak and they'll feel dizzy and they'll pass out and you fall down, right, when you have hypotension. Sometimes this happens when you get up too quickly. So if you're lying down, probably everybody's experienced this, you're lying down, right, and your blood pressure is at one thing and your heart is at the same level as the rest of your blood vessels. And then all of a sudden you get up really fast and you're like, whoa, like it turns white, you like almost fall down. And that is because your body is having a hard time maintaining the amount of blood pressure necessary to go to your brain. So your brain has kind of had not enough oxygen momentarily, right? And so it's really important to be able to adjust that. And people that become elderly people have a hard time adjusting from like lying down to getting up. And so being able to adjust between those two is important, okay? So we have a negative feedback mechanism that is controlled by the brain. And the part of the brain that controls blood pressure is called the medulla oblongata. So my control center is the medulla oblongata. And this is a part of your brain stem. So even if you become brain dead and your cerebral cortex does not work, your medulla oblongata can control respiration and blood flow, right? So it's an automatic part of the brain. So the stimulus could be a low blood pressure. So let's say my stimulus is a low blood pressure, so low BP. Okay. We have receptors inside of the aorta that are able to detect blood pressure, and these receptors are called baroreceptors. So like barometer, right, baroreceptors are located in the aortic arch. Okay. So from the control center, we can then send a signal out to the effectors. So in this case, the effectors are the heart. And one thing that your heart will do to boost blood pressure is it will increase heart rate. So your heart rate will go up. So your sympathetic nervous system will signal the heart to increase. And then we'll also get the effector, which is the blood vessels. So one thing that the blood vessels do in order to boost blood pressure is they constrict. So in the blood vessels, we get vasoconstriction. So when they constrict, the diameter becomes smaller and the blood pressure is boosted, right? So then blood will flow more readily to, say, for example, the brain. So this would be like when you get up, right? And the opposite happens when your blood pressure is too high. So I put, these are the effectors. So if your blood pressure is too high, the baroreceptors detect that and they cause exactly the opposite. So they would cause the heart rate to decrease, and then they would cause your blood vessels to dilate, and that would bring your blood pressure back down to normal. So if we look at factors that affect your blood pressure, And we'll talk more about this because actually your kidneys play a huge role in maintaining blood pressure. So factors in blood pressure, variables. One is heart rate, right? So increased heart rate increases pressure. Another one is blood volume. So if you increase the blood volume, you increase your pressure. And likewise, if you lose a lot of blood, you can go into what is called hypovolemic shock. So like the loss of blood, massive loss of blood, can cause hypo, so that means low, volemic, that means volume, and this is shock. So it generally, hypovolemic shock will make you become unconscious. So you'll go into an unconscious state and you can actually go into coma from having not enough blood. But our blood volume can also increase if we increase our intake of salt. So we'll talk about how when we increase our intake of salt, we absorb more water in our kidneys, and that can actually also increase our blood volume, okay? And then obviously we talked about this up here, the blood vessel diameters. Right, so if we increase the diameter, this increases my pressure. And if we decrease the diameter, this decreases the pressure. So we were talking about one thing that affects blood vessel diameter, and that is plaque buildup. So we talked about atherosclerosis. Right, so this is plaque buildup. Right, and so that would also affect the blood pressure. So if you have atherosclerosis, you're going to have a hard time with your blood pressure. And it kind of increases blood pressure. Blood pressure can also lead to atherosclerosis because it can kind of damage the blood vessel wall, right? And so it can lead to maybe that wall becoming damaged and plaque starting to build up. Okay. So we're going to watch a short little video that talks about atherosclerosis and how they would go in and treat a person that has a blocked coronary artery before the increase in the pressure could actually lead to a rupturing of that and a possible heart attack. So this is maybe only 15 minutes, maybe that. Oops, volume. Okay. Pause. Sorry, pause. I turned off the volume to the, where is it? Why isn't it pausing? No, stop. There we go. Okay. Okay, why don't I have sound now? Anybody? Oh, there we go.
Our lives depend on the health of our coronary arteries. Yet 16 million Americans suffer from coronary artery disease. Georgia Chan Downard is about to discover that she is one of them. She never suspected that, like so many others, she was at risk. But her doctor did.
My doctor thought it was about time I had a stress test. I could tell as he was looking at the graph that there might be something. Maybe it was instinctive on my part. Maybe I was just nervous. And he turned to me and he said, there are some irregularities here. I didn't really understand until I said to him, well, exactly what does this mean? And he said, I think maybe you have a blocked artery.
Heart disease was far from Georgia's mind. She had no obvious symptoms, no chest pain, no shortness of breath. But Georgia did have high cholesterol and a family history of heart disease, which worried her doctor. He recommended a closer look, a non-routine procedure using a highly sophisticated CAT scan that can picture the beating heart in 3 dimensions.
This is what your heart looks like in your chest. It's not like an artist's rendition. It's really actually what it looks like. Here is the left coronary artery that comes off of here. This artery looks very large and healthy up here, but then suddenly there's a big change from this size artery down to this size artery. And then it kind of opens up again. This right here is the area where it looks like significant blockage.
Because her artery was severely blocked and appeared vulnerable to imminent heart attack, her doctors decided to insert a stent, a tiny mesh tube to open the narrowed artery. Stenting is a routine procedure, but very recent studies suggest that some patients may do as well with intensive treatment with drugs. Georgia's hidden heart problem is due to atherosclerosis, deposits of plaque in the artery wall. In healthy coronary arteries, the blood flows without obstruction. In diseased coronary arteries, a fatty substance called plaque forms in the artery walls, and as the disease advances, may bulge out into the path of the onrushing blood, blocking the oxygen and nutrients the heart desperately needs, and from time to time, causing symptoms like chest pains and shortness of breath. But heart attacks result more often from plaque that does not protrude into the artery itself, but remains hidden in the artery wall.
One of the scariest things about coronary artery disease is that it can remain silent for so long. You can have plaque buildup in the coronary that isn't causing you any problem, doesn't cause you any symptoms, doesn't even cause a positive stress test, but suddenly ruptures. It ruptures, it causes a blood clot to form, the rest of the coronary artery, the rest of the pipe suddenly gets blocked, and a heart attack occurs. And that's really the most common cause of heart attack. This is what kills people, often in the primes of their lives.
All plaque is dangerous, but some plaques are unstable, on the verge of rupture. Scientists are today trying to determine how to identify the unstable plaque, while doctors try and help patients minimize their risks.
The plan right now is to manage the coronary disease in the arteries. Your blockage, if it was up further, up at the very origin of that artery, that's a very dangerous obstruction. And if it closes, generally causes a very extensive amount of damage to the heart. Your blockage was in the mid portion, it would still cause a pretty good amount of damage that would certainly alter your life, but it's not exactly as lethal as the more proximal lesions.
I have a small gym in my building. Do you suggest I, go down and exercise?
I would not. I would wait.
No?
I would do
Wait
all of your
until after
normal
the stress
activities. I just wouldn't be breaking a sweat. I wouldn't be getting on a treadmill at this point, only because there's some evidence that you can jeopardize the stent opening.
Okay.
So if you do it too early.
Okay.
So what we're going to do next is.
What a pity. Sorry.
Well,
I'm not a big fan of exercise.
You'll get there.
I know.
And by the time you finish cardiac rehab, you'll love exercise so much you won't be able to wait.
Okay. Any dietary restrictions other than the obvious?
The obvious. It's really fat, cholesterol, red meats, egg yolks, cheeses, whole milk, switch to skim, or fish, vegetables.
So remember that they said that it wasn't dietary, that it was something else that was causing the cholesterol. At least that's what they think.
In her?
In her. So this was before they came out with the dietary cholesterol. Does it increase your risk for atherosclerosis? So
then if you don't get it from diet, where does it come from?
it comes from the concentration of the LDL versus HDL. Remember, LDL is the lipoprotein. So for some reason, people that have high LDL have more cholesterol in their tissues, and it causes that to build up in their arteries. And it can be genetic. We mentioned it could also be due to like smoking or lack of exercise. So that's why I was telling her she's going to have to start exercising, because if she started exercising, then her LDL levels should drop, and then plaque buildup is going to decrease in her arteries.
And so then having the high LDL is not from dietary.
They don't think it is anymore. Yeah, because all cholesterol is the same. Plus, there's no such thing as good cholesterol, bad cholesterol. It is the proteins that transport them. So for some reason, the body produces too much LDL versus HDL.
So you can smoke and eat as much as red meat as you can as long as you run.
No, I'm sorry, smoking